G'day, folks. Today I'm looking forward to chatting with Dr. Marty Leon, a legendary interventional cardiologist who has had an enormous impact on the practice of cardiology globally and the medtech industry along with it. He is currently professor of medicine and director of the Center for Interventional Vascular Therapy at Columbia University Medical Center, New York-Presbyterian Hospital. He is the driving force behind the Trans-Catheter Cardiovascular Therapeutics, or TCT, conference, now in its 34th year, where he has set the gold standard for the live training of interventionalists and other physicians around the world, and for showcasing the latest developments in medtech. True to his academic roots, Dr. Leon also founded the Cardiovascular Research Foundation, where his work has expanded to cover additional clinical challenges like diabetes, obesity, heart failure, stroke, and more recently, the impact of the pandemic on cardiovascular care. He has been the principal investigator on more than 75 clinical trials, many of which have changed the practice of medicine. I look forward to exploring the factors that shaped who he is today and what lies ahead for him. Welcome, Marty.
Thank you, Andrew. It's a pleasure to be here.
So we've got to start off with your formative years. You were born in New York City. Why don't you tell us a little bit about your early life and influences?
Yes, I was a New York City kid, a middle-class Jewish kid growing up in the middle of Brooklyn, in a very middle-class neighborhood. It was a fantastic childhood. There were advantages and disadvantages growing up in a big city like New York. I went to public schools. We had a very interesting and heterogeneous environment where we grew up with a lot of racial and geographic diversity, which I frankly enjoyed. And I benefited from being in the city. But it's a very interesting lifestyle because you really become focused on what it is to grow up in a big city like New York, where you don't see trees, where you don't see stars, and where the background noise really is universal. But it also has a kinetic energy. And I think even as a kid, I enjoyed the kinetic energy and the magnetism of being in a big city with a lot of things happening at the same time. So it was an enjoyable and exciting experience being in New York. One of the reasons why later in my career, I decided with my wife that we needed to find a way to get back to New York to relive that kinetic experience.
Can you tell us a little bit about your parents and how they may have shaped you?
Yeah, very interesting. It's a very traditional environment. My grandparents emigrated from Eastern Europe, Poland, Russia. My parents were born in the United States in the early 20th century. My dad was a NYU graduate and became an appellate conferee for the Internal Revenue Service and worked for the U.S. government for about 30 years. I made a tactical mistake in asking him to help me fill out my tax returns when I became an adult because he thought he was still working for the government. My mother actually, it's interesting in that my family was very maternally oriented. My grandmother was the icon of the family and one of the wisest people that I ever knew. And my mother certainly, I think, fell into that category. She went to college at Brooklyn College and then left college because her twin brother, my uncle, wanted to be a veterinarian, and we didn't have the economic resources to support his veterinary education. So she quit college to go to work to be able to put him through school. And he became a veterinarian, and she got a job and was successful and ultimately met my father. But it's that kind of family relationship that was extremely meaningful, very education oriented, I think very humble, but also focused on excellence. So I think education and excellence were two of the themes that were important to me that I learned from my parents, and many other lessons which we'll get into. But I was very fortunate to have a loving home and it certainly made a difference, especially growing up in New York and facing some of the adversity that you encounter in a big city like New York.
So I think a couple of themes that come through for the rest of the discussion. I think excellence and kinetic energy, and I think kinetic energy definitely explains a lot about you. Also very interested in theater and music, so that that's a fit for New York City.
Yeah, well, in New York, I think that there are so many different opportunities that you have. If not best in class, you have high class opportunities in many different areas. And I've always enjoyed music, mainly, and as an adult, more classical music. And even though I can't claim any clear linkage, but my daughter is a musician, and she does more modern music. But I think that certainly our home reflected an interest in music. I always loved the theater. I remember as a young person growing up in Brooklyn that the trips to Manhattan to go to Broadway for me were extraordinarily exciting, and I took that theme into adulthood. So experiencing the New York Broadway theater and off Broadway was very exciting for me. And I was a sports enthusiast. I loved all sports and had aspirations someday of actually a career in professional athletics. That didn't work out, so medicine was number 2 on my list. But I've maintained the interest as, if not as much a participant, a spectator in sports.
So I think it is another common element of ours. I hoped one day to be a professional athlete, and that clearly didn't happen. But another version of theater is quite frankly the New York Yankees. So you're a very, very strong Yankee fan.
Well, I had to be, because my dad grew up really in the background of Yankee Stadium in the Bronx. And my first experiences at the ballpark were when I was a toddler, and my father took me to a World Series game, sitting in the bleachers and watching the Yankees playing the Brooklyn Dodgers when Don Larson pitched what is called a no-hitter.
So that was actually my next question. It was about you telling the story of that Don Larson experience. I remember being at a dinner with you in New York City with a group of well-known surgeons and cardiologists. And I'd actually brought my daughter with me. Late into the night, I remember looking over with you and seeing Michael Mack, a very well-known surgeon, with my daughter huddled away having a whispered conversation. They then came over to us and asked a question. Andrew, would you be comfortable? Jordan and I have a question that we'd like to ask the table. Didn't know where we were going to go, but obviously said yes. And Jordan asked a question about what was the most memorable sporting experience you'd had. It was quite remarkable, the responses that we got around the table and the depth of the emotion. But the person that I most remember was you telling the story of that Don Larson game. Would you mind telling us that today?
Absolutely. This is a unique experience. So spending time with your dad in special events is something that I think we all cherish. And this was the first time I had gone to a baseball game. And the baseball game happened to be a World Series, which is unusual. The bleachers are the area where, it's at the end of the baseball stadium. So you're not sitting in the front of the action, but behind the action. And I watched with him a baseball game that was historic. It was what's called a perfect game, which is that it was a no-hitter. And the impact of that was so substantial that it certainly fueled my interest in being a lifelong fan of the Yankees. And the center fielder of the Yankees was somebody called Mickey Mantle, who was an iconic figure in New York athletics. And I aspired to replace him in center field at some point in my life. Again, that never happened, but it left such rich memories that I certainly benefited greatly from my time with family and with the opportunity to be a true New Yorker during a signature event. So very memorable, and I still experience the emotions when I talk about it. It's excellence, and there's tradition, and those themes are important to me.
That night you were very emotional, and I think that's where I got to have a real good understanding of who you were as a person. That was just a little glimpse into Marty Leon. You've also dealt with tragedy at a young age, and this seemed to set, quite frankly, the course, or at least it reinforced the trajectory of your career. At 6 years old, you declared you wanted to be a doctor.
Andrew, I think we're all faced with adversity, and it's a matter of how that adversity influences your thinking and shapes your life and how you manage it. And I've had my share of unpleasant experiences, but I've tried to, and even still, I have a saying that I share with colleagues. I say, you come to work every day trying to understand that there's going to be a crisis of the day. And you need to come there expecting and being able to manage and overcome that crisis if you're going to be successful in life. I learned that at a very young age. When I was 6 years old, I was a middle child. There were three boys in the family. My older brother, who was 3 years older, died. He died of a medical illness that arguably was preventable. And it really had a tragic effect on my family. It really devastated my parents. And it really shaped my thinking. And I had a firsthand glimpse at what a medical event can impact a family. And I reasoned at the tender age of 6 years that under those circumstances, if you had the ability to be able to reverse that or to prevent that, that would be a noble goal. And it wasn't a very conscious declaration. And it was not very insightful, but said for the first time that, this is something that I should really consider doing, to try to be a physician and to try to be a good physician that could prevent these things from happening. And it's ironic because I never deviated from that point. So from the age of 6, I never really cared about doing anything else. And I don't come from a medical background, as we just discussed. So there's no one else in my family who was a physician or was working in science. So this was a unique experience and helped me to understand that these kinds of life experiences that affect you viscerally can be strong motivation. And I try to use that positively.
Okay, and you've certainly done so. I hope you feel proud of what you've been able to accomplish and what you've been able to accomplish for so many families. All right, education. So where'd you go to high school, and what was Marty Leon like as a high school student?
I went to the public schools in New York. And the public school system in New York was quite well developed, extremely competitive. We had 40 students in a high school class, which is very large. So there's no opportunity for personal education. So you had to learn how to take advantage as best as you could from the environment. And it helped me. I believe in excellence. I believe in education, but I'm a very fierce competitor, hopefully not in a negative way, but it's important for me to be successful at what I do. And I think when you grow up in the New York City public school system, competition is really part of the spirit that you bring. And it helped me to be able to achieve sufficient success that I could, go on to college and, have different educational experiences. But it was a very competitive environment.
Yeah. So 2 ways of looking at competition. It can be combative or it can be resilient. And it sounds like you look at it from the resilient pathway.
I really did because, and I'm still a very competitive person, but not in a negative way. I want to be impactful. And I think to be impactful, you have to focus on being excellent at what you do. And that forces you to have some level of competitive spirit. But I think you can turn that into a strong positive. I think too many people allow the competition to to introduce negative emotion and negative energy. And I don't think that's constructive. But competition is important in sports and medicine and life.
You know what? I think it's competition for me. Competition is just part of the process. It's not the process. It's just part of it. Okay, that said, you then went off to Yale for med school, studying there to complete internal medicine, internship, residency, and a cardiology fellowship. You were there for 9 years, give or take. Any memories you'd like to share? And why cardiology?
My brother was an undergraduate at Yale, so it was great that we could share time in the same university. I was in the medical school. But I had an opportunity to meet a whole new diverse group of people. It's a fairly eclectic environment in that it was the only medical school in the United States that didn't have grades. It was pass-fail, but you were forced to do a PhD equivalent thesis as part of your MD degree. So it taught me the importance of doing research and having a mentor and being able to be self-educated. So when you go to a class, they wouldn't tell you this is your textbook, but they would say this is the topic that you're going to be studying, and these are the 5 textbooks that might be of interest. You choose what you want to read. So it was striking, completely different in terms of an educational environment. But I think for lifelong education, it more closely simulates what you need to be doing on an ongoing basis. And I really learned from that experience. So I have extraordinarily fond memories of Yale and the opportunity to be thrust in that, very high level environment with some extraordinarily qualified and capable people.
So was that where you met Dr. Larry Cohen? Was that at Yale?
I did, yes. Larry Cohen was the chief of cardiology. He was my thesis advisor. He was one of the key people that was my mentor. But it's interesting. I came to Yale with a differentiated notion that I wanted to be a cardiologist. I didn't really think this through well, but I had another one of those life experiences. I mentioned my grandmother, but just before I went off to medical school, she unfortunately suffered a heart attack. And, those days we didn't call ambulances. You drove each other to the hospital. So, in taking her to the hospital, she literally died in my arms. And that experience was very profound for me. And it helped me to think that cardiology might be, again, an area that I would be interested in focusing on. And as I got into medical school, it was a perfect fit. So it just continued to grow and develop. And then when I met Larry Cohen, he was this iconic figure who had spent years at the NIH and was both academic, but the consummate clinician. He was somebody who really reflected what I thought the perfect physician would be: an impactful academic who cares about patients and who is a mentor and educator. So he was truly an important influence on my career and life.
So then that leads into your experience at NIH. So another person who spent time at NIH was Dr. Fogarty. So that's really intriguing to me that 2 really remarkable innovators both spent formative periods at NIH. Why NIH, and what did you learn there?
Well, Tom was a legend. And when I went to NIH, his name was mentioned many, many times because of his unique attributes and the impact that he had. Larry Cohen told me that if I wanted to be a successful academic physician, I had to go to the NIH. Frankly, academic medical centers were less academic at that point. And a lot of the true academia came out of the NIH, and it was the halcyon days of the NIH. It was just after Eugene Braunwald left. He had set up the National Heart, Lung, and Blood Institute. And this was an opportunity for me to be in an environment that had enormous tradition and that would give me a chance to think and hone some of my skills. I've always had this sense of paying your dues. And I felt that if I was going to be good in academic medicine, I needed to allow myself to mature on the academic side to be able to be successful and to be creative. So I was very fortunate. I had many mentors at the NIH, and I became involved in a whole series of different projects. Nuclear cardiology was just beginning, and I worked closely with Bob Bono, who is one of the iconic figures in nuclear cardiology, and he became a close friend and mentor when I was there. I got involved in cardiovascular pharmacology. I learned about experimental physiology and worked in the experimental animal labs. Those were some of the first experiences that I had because hemodynamics was invented at the NIH in the animal laboratories. And then I got an interesting exposure to biomedical engineering and biomedical engineers and worked very closely with them on a whole variety of interesting projects. And finally, as things began to progress to the clinical trial phase, my earliest days as a clinical trialist were really exploring opportunities at the NIH to design and understand how to do clinical research. So over the course of that period, and at some point I became director of the cath labs there, and I set up an experimental angioplasty unit. I learned so many fundamental aspects of what it means to develop ideas and to take ideas through the various phases of exploration, creation, preclinical experimentation, and then into clinical trials. So that to me was a fascinating experience. And the first TCT was when I was still at the NIH.
Yeah, I was going to ask, that's the next question coming, because you were just talking about setting up the angioplasty labs, and I know there are a lot of other labs associated with transcatheter therapies. So that was really the formative period for what has become such a large clinical therapy, transcatheter. So it was in 88. So 1988, you're still there along with Kenny Kent. You founded TCT. It's grown, I'm pretty sure at the time, and I've seen some of this evolution. It was a relatively niche conference in the beginning to what today is a remarkably successful and influential meeting. What was your vision for it? Did you expect TCT to become what it is today when you started this?
Well, Andrew, a lot of people believe in 5-year plans and long-term visions. I've never been very successful at that. I tend to be influenced a lot by what's happening in the moment. What I can foresee is the more immediate future. And I became really interested in, I was involved with Kenny when he was the third person to do balloon angioplasty. And as he was lauding the impact of putting a balloon in the coronary, I was taking care of his patients and experiencing sudden closure and restenosis. And I was saying, this is a failed technique. This is a terrible technique. What are you talking about? And that's when we began to explore other ways to be able to remodel vessels that I thought could be safer, more effective, more durable. And that got into the experimental angioplasty theme. And then during the 80s, those concepts became reality in the form of a variety of clinical devices, such as stents and atherectomy devices. And I wanted to explore that more deeply and create an educational vehicle to expose those new techniques. And that's where TCT came, to really see if we could develop basically a multidisciplinary workshop to bring engineers and industry sponsors and scientists and clinicians together to look at some of these new techniques and to see how we evaluate new therapies. And that was the genesis of TCT. It was born on a Sunday afternoon on Kenny Kent's back porch over a 6-pack of beer. And he said, go with it. And I came up with a program, and we had a very small faculty, but I mean, we're talking about people like John Simpson and Patrick Sarai. So it may have been a small faculty, but these were the heavy hitters, frankly. And we learned a tremendous amount from that experience. And even though we thought of this as being a boutique meeting that might last for a year or two, it mushroomed in various phases into something that obviously grew into a signature meeting that helped to define the subspecialty and paralleled its growth.
I just got the question of why. I was just thinking as you were talking then, as you're involved in both the technology and the therapy and then clinically using these things, what caused you to say, hey, I want to educate an industry? I want to educate a field, I should say, not an industry. That just seems an extra step of what was it in you that said, hey, not only is it good enough to be involved in this, I want to drive an educational program.
Well, I felt, it's kind of interesting, and I believe strongly in peer-to-peer education, and we already have talked about excellence and quality and how that's terribly important. One of the reasons that I decided to go into interventional cardiology was that my mother, at a fairly young age, in her early 60s, developed unstable coronary disease. And she was operated upon and had coronary bypass surgery. This was before balloon angioplasty was well developed. And unfortunately, she had a negative outcome. She had multi-organ system failure and died 14 days after surgery. And I was in the middle of that I was a cardiology fellow at Yale at the time. And it really influenced my thinking that this idea of opening the chest and bypassing focal obstructions in coronaries is insane. And we've got to come up with a better way. So it really drove me to think that lesser invasive techniques are important, but also the procedural excellence and being responsible for the quality of how proceduralists practice their trade is something that is critical if you're going to deliver a high level of consistent medical care. So I became very interested in the idea of training and trying to see how we can improve peer-to-peer education. And that was part of the TCT experience, to be able to interact with peers to make sure that if they're going to get involved in these new techniques, that it has to be practiced at a high level and that the standards that we set have to be extremely high. And we have to police our subspecialty. Now, we haven't been perfect, and there's a lot more that I think can be done, but that certainly was part of the motivation.
Yeah, well, as I said, it's a remarkably influential meeting today. And so, just want to, your forethought, your foresight was remarkable. So thank you for that. The ongoing COVID experience has caused us all to reevaluate many things, I think, both personally, professionally. How do you see this experience changing TCT in the coming years? Yeah.
Well, that's a great question, Andrew. And it's still in evolution. The pandemic is not over, and we're not quite sure what people are calling the new norm, what that's going to be. I think that we have learned a lot of lessons, though. I like to think that, again, growing out of adversity, we can apply those lessons in positive ways. Certainly some of the lessons that I think are important relate to the way we educate people. Just the fact that we can have this Zoom conversation and have remote access to more people is extremely powerful. So being able to refine that aspect of how we communicate and educate with colleagues, I think, is going to be a powerful adjunct to what we do from an educational standpoint. So I think that it's one of the things that we've learned from this pandemic, from the standpoint of clinical care, the way we communicate with patients, just to be able to allow these televisits or telemedicine or remote connection with patients, I think, is an important concept that I think is born out of the pandemic that will stay with us for the long term and be expanded. It doesn't completely supplant the in-person experience, but it certainly does help in terms of creating a totality of care presence that allows you to be more effective to more people. The other thing I learned from the pandemic is that when you're faced with this kind of crisis, especially as what we were faced with in New York in the surge of 2020, where every day was literally a whole new series of crises, that you really have to think carefully about your professional goals. So people have become very reflective about what they want out of their professional lives. And I respect the fact that people are making a lot of decisions based upon those careful reflections. So being more introspective about your goals, I think, is a good thing. And the last lesson that was most important to me is that I've always had this sense of that giving back is something that people should really be thinking about. And when I was at the NIH, when you're a patient at the NIH, there is no billing office. There is no charge. Everything is for free. And we had wonderful patient-related experiences in that charitable environment. Now, there's a downside. I was at the NIH for 9 years, and I was a section head and the director of the cath lab at the age of 39 with a wife and 2 kids, and my exit salary was $52,000. So there's a downside to that too. But the reality was there was such a good feeling about being in an environment where you could really express in a more pure sense the way medicine should be delivered to patients. And I felt the same during the pandemic. I was incredibly impressed. It wasn't the graybeards like myself that really drove the clinical excellence that allowed us to overcome those crises. It was much more the younger physicians. And we had in our minds that there was a sense of entitlement and that the younger physicians weren't really as I don't know, that perhaps they were less hardworking or less focused on academics. But what I observed was an extraordinary expression of medicine in its greatest tradition in terms of how the young physicians stepped up and exhausted themselves in ways that were hard to describe in order to manage these various crises. And that experience really profoundly affected me, and I've really taken it as a personal mission that we need to continue to mentor and encourage these younger physicians who have done so much and who've shown the way as to how to give back. So I think this notion of philanthropy and being able to give back to medicine in all kinds of ways is an important consideration and something that certainly going forward will be part of my continued career.
Yeah, a couple of themes to pull from that. One, we also saw during that surge in New York, folks from here, younger physicians from the West Coast, traveling over to help out. Guys like Vic McRae and others, just remarkable from my perspective. So the younger ones did step up. But the other thing, I happened to have the fortune of catching you at a couple of conferences the first time that you'd got out, the first time that I'd got out. And I was pretty impacted by the impact COVID had on you. I remember you talking about the sense of the loss of interaction and the humanity that you got to see. How have you changed as a result of this? So yes, I understand the focus on give back, but I think it had a pretty significant impact on you.
Yeah, I think it's had an impact on everyone. I think that the lack of socialization and the isolation impacts everybody differently. So I think the way you view family, the way you view friends, the way you view how you negotiate a professional environment, the way you treat people, I really do think that these experiences that we're all working through, have been very telling. And you hope you become a better person out of all of this. You don't want that isolationism to persist. And the impact of lack of socialization is very powerful. And it's helped me to understand the importance of being able to connect with people. So I think many lessons that, again, hopefully will shape things as we go forward.
And I hope things like TCT and TBT and all the other conferences, one of the tremendous elements of those conferences for me is that human interaction. It is meeting up with people. It's that sense of community. So while I think we're going to have to modify how conferences go, how they function going forward, I hope they all don't go, purely virtual. I think the human element is essential to these things.
Yeah, I certainly agree, Andrew. I think that, to me, what had been profound, having lived through every year at TCT, was the feeling that if you experience the meeting in its totality, you can almost get this enteric sense that the field is moving forward. And it's not one thing, it's not one presentation, it's not one piece of science or one meeting. It's the totality of the impact of interacting with so many different people with different ideas, coming together to be able to create new ideas, to be able to take things to another level. So that, to me, can only be achieved during an in-person experience. And I hope that we don't lose that, because there's only so much you can do via Zoom.
Totally agree. Would have been better if we were sitting together just having a beer.
I agree.
Well, I hope you enjoyed that as much as I did. I hope you discovered some new dimensions of this remarkable, multi-talented person. But there's so much more to uncover about Marty Leon. Make sure you subscribe to MedTech Trailblazers to learn more about him in the second episode of this series. Thank you.